It was clear I needed to get a magnetic resonance image scan as the next step to examine potential organ and tissue damage. I needed a referral at most places with such machines and went to Christ Health Center next on May 9th, located at Christ Health Chalkville, 2152 Old Springville Road, Birmingham, Alabama, 35215. Christ Health Center, I was told, was a place where people with no insurance and limited income can go and receive a good medical care without a high price tag. After a nightmare experience at the St. Vincent's East Emergency Department, I went there expecting to get an official diagnosis from a doctor. This facility was observably full of low-income customers, myself the lowest income of them all. I have less than nothing. The staff was very young, like their first job young, first job out of college young. On May 9th, I saw Terry Daniel Smith, MD. This man was younger than me, which is not a situation I've run into going to the doctor in my entire life. The only reason I've been to any doctor or hospital in almost a year pertains solely to a skull bone fracture or break I was carrying around, which remained undiagnosed and untreated. Insultingly, almost the first thing that I was asked pertained to behavioral health, a condition which I do not possess and have never seen a doctor for and wasn't there to discuss that day. Side note, from this point forward, every doctor's visit I made was tainted, I believe, by St. Vincent's East Hospital's erroneous diagnosis. A common quip was to print out the text from St. Vincent's East and repeat their incorrect diagnosis. My psychological state was challenged. Many visits to doctors began in this fashion, and some length of the discussion was like a tug of war, with the doctor trying to steer my $50 to $300 worth in the direction of mental health, behavioral health concerns, and me trying to get recognition for a solely singular and very physical neck injury. This would continue until March of 2020, since I was referred to Christ Health Center by SVE, which, as I later found out, lied to me and covered up my injury in a technical-oriented and orchestrated fashion. I believe St. Vincent's East Hospital employed a technique of character assassination, using talking points in my file in order to silence and marginalize me, i.e. calling me crazy and hooking me on psychotropic drugs to zombify me and place me on a shelf effectively. This was supposed to be the job of Christ Health Center and maybe some other doctors I went to, but it didn't quite work out that way. I reiterated my symptoms and my belief that St. Vincent's East had not properly diagnosed my injury. Much of what was discussed was not reflected in their record. I felt I was dying. By this time, getting into a car and to go anywhere was a struggle. I could articulate myself, but talking and conveying my thoughts was difficult. I feel the doctor did not treat me as a human being. He stood too close with his face in my face and asked me questions like a rookie wannabe police officer. Every doctor I said I visited and hospital, he would only ask me what time and date did I go there, and discard the details, moving on to something else. I felt he didn't believe me. I may have appeared as a local street drug user, for which this area of Chalkville-Springville Road was a well-known source for decades.